Welcome to the second part of the axial skeleton presentation. We're going to talk about essentially the vertebral column first and then the thoracic cage. We definitely talked about the skull extensively already. We're going to talk about general characteristics of the vertebral column, and then we're going to go into some detail. I just want to point out that you will find, especially on YouTube videos online, different pronunciations of the word vertebral. Many will pronounce it as vertebral. So I guess there are two different types of pronunciations out there. I am going to stick to the more Latin one, which is also the type of pronunciation that you will find in your person in the mastering A&P. Okay, so same thing for other words I'll point out, like facet, and you can also find it pronounced facet. So just keep in mind that sometimes it happens in medicine and in science in general that we have multiple pronunciations out there. They're all accepted. All right, so the vertebral column extends from the skull to the pelvis. Let me grab my pen here so I can kind of like from the skull over here to the pelvis. And vertebral column is also called the spine or spinal column, and you'll hear me sometimes call it that way. So they are very, very interchangeably used terms. The functions of the vertebral column are varied. First of all, the vertebral column transmits the weight of the trunk to the lower limbs. It surrounds and protects the spinal cord, of course, that which is pretty much enclosed in it, as we'll see, and to provide attachment points for ribs and muscles, okay, as we will see. Excuse me. Generally speaking, the vertebral column is a flexible, curved structure, okay, and contains about 26 irregular bones, which are known as vertebrae, okay. As shown here already, vertebrae are divided in 5 different regions known as cervical, thoracic, lumbar, then there is the sacrum and the coccyx. And we're going to explore all these different regions. Cervical region is the first region and consists of 7 vertebrae, and they are indicated from number 1 to number 7 with the letter C that stands for cervical. Next is the thoracic, and we're moving from superior to inferior position. And the thoracic vertebrae are 12, and they're indicated from T1 to T12, okay? And then there are the lumbar vertebrae, which are 5 vertebrae from L1 to L5, okay, in this area. And then we have the sacrum, which is 1 bone formed by 5 fused bones, basically, which forms this more massive structure here, more supportive structure. And then there is the coccyx, which is also fused by several bones, typically 4 bones. So when we talk about the vertebral column, we can recognize curvatures of this of the column, and basically there are 4 major curvatures, but there are the cervical and the lumbar, which we associate them together, although they are actually distant from one another because of the type of the curvature that is present. And when we talk about curvature, we we refer to a posterior view, a posterior orientation. So first of all, let's orient our spinal column here, and I put this drawing here to make sure you orient yourself always in the right way. So this is going to be your anterior, and this is going to be your posterior view. And so if I am looking from posterior point of view, the cervical curvature and the lumbar curvatures are concave. Something concave is something that goes this way, right? If I am looking from, if this is my point of view, okay, this is concave. If I were to look from the opposite point of view, okay, my eye was here, okay, instead of that the other way, this would be convex. Okay, these are just general terms, so you should know. And so looking from posterior point of view, the cervical and the lumbar curvatures are concave. Okay, see the concavity here, 1 and 2. Whereas the other two curvatures, the thoracic and the sacral curvatures, again, looking from a posterior point of view, are convex. They go this direction. Remember, my eye is here. I am sorry about the eye that is so elongated. I'm looking from this point of view, okay? And so they are, again, two convex curvatures, okay? So that's why we say that cervical and lumbar curvatures are concave posteriorly, while the thoracic and sacral curvatures are, did I say convex? I'm sorry, concave posteriorly, and thoracic and sacral curvatures are convex posteriorly, okay? So again, this is the last thing I just said. All right, so other general features that I want to talk about, for the vertebral column are ligaments, okay? There are two pretty long ligaments, which are longitudinal ligaments. These are the anterior and posterior ligaments, which are highlighted here, anterior ligament and posterior ligament, okay? This is the posterior longitudinal ligament. You kind of have to take away some of the processes of the vertebrae in order to appreciate the posterior ligament, okay, which is over here, runs longitudinally all the way in the vertebral column. And then there is the anterior one, which is highlighted here, okay, which is in an anterior portion. Remember, this is when we look at here, we're looking from in a kind of lateral view, and this is the anterior, this is the posterior. The anterior is always where the bodies are. As we'll see, this is known as a body of vertebra, where all the processes are, is always the posterior, okay? So orient yourself, okay? Every time you're looking at a structure, you have to try to orient it first, otherwise you may get lost. All right, so anterior and posterior longitudinal ligaments are continuous bands that run from neck to sacrum, so all the way down in the front and the back of the spine. And these ligaments are very important because not only support, but they also prevent hyperextension backward or hyperflexion forward. So excessive bending, basically. Besides these two long ligaments, here in the between vertebrae, we can also recognize short ligaments which connect each vertebra to the one above and below. For instance, here are highlighted in this diagram the interspinous ligament and the supraspinous ligament. Okay, these are the short ligaments we are talking about. Then here there is also another one. This is a thoracic vertebra, where we find the lateral costotransverse ligament. We're going to talk about this ligament in particular when we talk about the thoracic vertebrae. Okay, never forget that, of course, we already talked about this. Between the bodies of the vertebrae, there is a disc, which is a fibrocartilage disc. Okay, this is known as intervertebral disc, which unites and keeps the vertebrae together and also cushions the friction between the vertebrae, which are bone. Okay, bone material. All right, so now let's look at the general structure of a vertebra. Let's recognize the various portions of a vertebra. And again, always try to orient yourself. Of course, here we're not dealing with touching and three-dimensional experience, so it's a little bit harder. If we were in a real lab, we will be definitely always rotating structures. We'll have the vertebrae and we will learn in the lab how to orient them. Here it's a little bit more tricky, but not impossible, and you have your person activities that allow you to rotate structures. So go in person and study area and practice with these things. These are this is your lab, okay? All right, so let's identify the various portions of a vertebra. First of all, we have a massive body, okay? There are a couple of exceptions where of vertebrae they don't have a body, a real body, and we're going to see which ones they are. Okay, so this is the anterior weight-bearing region. Then we can recognize an arch, okay, a vertebral arch, which is composed of two structures known as the lamina and the pedicle, okay? So the lamina is this portion here, and the pedicle is this portion here, and so all together form this arch, okay, the vertebral arch. Then we have the vertebral foramen, okay, which is basically the opening through which the spinal cord runs, and is all the vertebral foramens of all the vertebrae form a canal, a channel, again, through which the spinal cord runs. In a lateral view here, we can appreciate these openings, okay? These are known as intervertebral foramina, a singular foramen. These are lateral openings for the passage of spinal nerves. You see how the spinal nerves here are represented. They come out from the spinal cord, okay? So these are important to remember as well. Continuing with general structure of a vertebra, we have to recognize 7 processes in a vertebra. And actually, you don't have to remember 7 things because many processes are present symmetrically on each side, okay? The first process, very prominent, very visible, is going to be your spinous process, okay, which projects posteriorly. So when you orient your vertebra, you know that when you see this single process in the body, you know that the body is your, looking at it, is your anterior part, and this is going to be your posterior portions of the vertebra, as it is oriented in the body, of course. Then we have the transverse processes, which are 2 processes that project laterally, okay? And these are your transverse, processes, okay? Transverse processes, okay? Then we have a superior articular process on each side, which protrudes superiorly, and shown here, superior articular processes. protrude superiorly, okay? So of course now I'm looking at a vertebra from here. This is an inferior view, right, of the vertebra. This is the inferior part of the vertebra, okay? And so you can see the body. This would be the portion of the body where it is covered in fibrocartilage, right, over here. And so, therefore, this is a superior articular process. Again, try to orient yourself, okay? And here, again, you can see this structure here, the superior process, articular process, and facet or facet, and we'll talk about this facet in a minute here. So protrude superiorly. Then there is the inferior articular process, which again is present on each side, and these protrude inferiorly. Okay, that's why it's called inferior. And again, there are two of them. So this is basically the last one that here, inferior articular. This is the facet that is highlighted, but this is the process itself. Each process has facets, as we all see, which are you can translate the word facet as face. They have faces, okay? And so we will recognize these facets pretty soon here and try to identify them and recognize them. So all these processes have functions as well. Of course, we don't just describe structures without understanding why they're there. They must have a function. And these serve as levers both for muscles of posture and for muscle of active movement. Okay, so that's all. And of course, besides that, also we'll see these facets or facets are also very important because they are the point of the interfacing point between various vertebrae. All right, so the next thing, again, I want to talk about are the facets or facets. Again, you can pronounce them in different ways. And I have a nice video that I'm going to show you. Hopefully it will play in the next slide. I believe it's the video. And the video really is nice because it shows you three-dimensionally what it's hard for me to show you in a lecture. Now, let's first learn about the facets or facets, and then we're going to watch the video. First of all, each vertebra has two sets of facet joints. One pair faces upward, and these are the superior articular facets, so they face upward, okay? And the other one, the other pair is oriented downward, and this is called inferior. Again, you have to rotate. So the inferior here will be here. These are the inferior facets. You won't see them because right now we are kind of looking at in this view more of we have more of a lateral view, more lateral and oriented towards where we want to look at the superior ones. Okay, so you don't see here very well the inferior ones, but they will be here. Okay, so in this diagram over here shows you that these are interfacing points between vertebrae, and of course the superior facets of one vertebra are connected to the inferior facets of the vertebra above. And when we look at the different regions of the vertebral column, we have to make a distinction because in the different regions in different regions, we can recognize that the orientation of these facets is different. For instance, if we look at the cervical, in the cervical region, we say that these facets are oriented at a 45-degree angle. You see that very well here. This is a cervical vertebra. And the orientation of these facets is not that I'm torturing you to remember this orientation. It's important to know because it determines the type of movement that you can have in that region of the vertebra. So, for instance, a 45-degree orientation of these facets allows a lot of movement, such as flexion, extension, lateral flexion, and rotation as well. Now, when it comes to the thoracic region, in the thoracic region, these facets are oriented with about 60-degree angle, and this reduces the movement. So the movement is kind of like reduced, going from the cervical to the lumbar region, okay, the possibility of movement. In fact, here we have a frontal plane movement, lateral flexion and rotation, but no flexion and extension in the thoracic region. And here, again, 60-degree angle. Now the other region that has very particular orientation of these facets is the lumbar region, in which these facets are almost oriented with a 90-degree angle, okay, and this allows only for flexion and extension in this area, okay. Now, each facet or facet joint is actually a type of is a joint to the next one, the one above or the one below, we can say, through a synovial capsule. Okay, so this is a synovial type of joint. Okay, so remember that for me. And this is what I'm asking you to remember: general characteristics and the different types of orientation in terms of angle that they form. Okay, in the three major regions of the vertebral column. Okay. That's what I want you to remember, and I do have this nice video. Hopefully it will play. Let's watch it together.
In this video, we're going to be talking about superior facet orientations. This is not going to be
Okay, so don't worry about all these details that he's talking about, because the main thing I wanted you to grasp is like the three-dimensional aspect where he rotates all the, shows you all the vertebrae, rotates them. So it really makes you visualize the facets or facets. And he's focusing on the superior articular facets, but it doesn't matter. Anyways, these are snapshots from this video. I think it's very well made. Okay, so again, recognizing where the facets are located and the type of angle and the type of movement that is allowed in every region. That's what is important for me to know. Okay, and of course, remember that type of joint there. All right, so now we're going to move on. Sorry. And we're going to actually now zoom a little bit more in the typical characteristics of cervical, thoracic, and lumbar vertebrae. They are slightly different, and there are some actually that are quite different. Let's start with the cervical vertebrae that run from C1 to C7. These are the smallest and lightest vertebrae. They don't have too much pressure or weight on them, and so this makes sense, right? Because they are the ones that are more superior. From C3 through C7, and then we're going to talk about C1 and C2 shortly here. They have these general features that we could recognize. They have an oval-shaped body, and except for there is an exception where C7. In a C7, the spinous process is split, okay, and we call it bifid. They have a very large triangular foramen here, shown here, and they have this transverse foramen here, found in each transverse process for a passageway of artery, okay, on each side. The C7 is the vertebra prominence. Can be felt through the skin and is used as a landmark, okay, and has this spinous process that is split, okay, is bifid. Now we're going to talk about the C1 and C2 as well. C1 has a specific name, is called atlas, and the C2 also has a specific name, is known as axis. These are very special. For instance, in C1, there is no body or spinous process, okay? There is no body. This is your C1. You cannot recognize a body in here like in the others. And consists in anterior and posterior arches, okay, respectively here, and the two we say lateral masses, okay, over here are pretty massive compared to, of course, the rest of the structure. And the superior surfaces of the lateral masses are these superior articular facets here, facets, I'm trying to highlight them here. And these are important because they articulate with occipital bone. Okay, an occipital bone, I have it here, has a feature in it, okay, which is, of course, left and right, is the occipital condyle, okay? And this is the region of the occipital that actually takes contact and articulates with the first cervical vertebra, C1, which is the atlas, okay, at this region. And this allows for movement for nodding, like yes. Okay, when you say yes, that's what the type of movement that is allowed. The second one, the second cervical vertebra, C2, is known as axis. This one has a body, and there's also a process. It's like the other vertebrae. The body though is pretty tiny, okay, and it's over here. And the body, major feature of the body is a dens. Dens means tooth, actually, in Latin. And so it's a kind of a prominence, it's a knob-like prominence that projects superiorly. And it projects into the anterior arch of the atlas, okay? So that's what over here you can see, okay? The dens of the axis projects into the anterior arch of the atlas, okay? So to connect with it. The dens is really kind of like it's the body, the formation of the body, if you will, of the atlas. And this dens is really a pivot, represents a pivot point for rotation of atlas and allows for movement of your head, like when you shake your hand to say no, okay? So it creates a pivot type of connection. All right, so this is kind of like a real image. Of course, you know, when we have a real bones in front of us, maybe these various structures which are not highlighted are a little bit more tricky to recognize, but here is the dens, okay? This is a superior articular facet or facet, okay? That's always there, no matter what. And then this is the spinous process, of course, okay? Transverse foramen, which is in the transverse process, as we saw in the previous slide. And so again, this axis, the dens is really the feature that if I were to ask you a question without even showing you an image, and I were to say this vertebra as a dens that represents a pivot point for articulation with the vertebra above, then you know this is the axis, okay? You cannot go wrong. It's a very, very distinctive feature. All right, now we're going to talk about the thoracic vertebrae, which span from T1 to T12, they increase in size as we move as we move down, and they articulate with the ribs, okay? Now they have unique characteristics that we're gonna pretty much dissect. The body is kind of like heart-shaped. You see the heart there. And the body presents facets or facets. They're called demifacets, but also called, and they're shown here a little bit better, also called costal facets, because they actually are facets that are important for articulation with ribs, okay? Costa is rib in Latin, okay? So that's why they're costal facets. And so there are there are four total, because there's two on each side of the body of a vertebrae. And so we recognize them as superior and inferior, okay? So this will be your superior and this will be your inferior, right? And they're on each side, okay? So these are additional facets. We don't find these facets on the vertebrae that don't connect with ribs, okay? So these are a distinctive feature. Now, generally speaking, this is a generic thoracic rib. There are some of the thoracic vertebrae that are not exactly like the others. For instance, T10 and T12 only have single facets, not two. Don't worry about remembering these very particular characteristics. Okay, it's too much to remember, so just stick to the very common, let's say the most common characteristics and features of this vertebrae. The vertebral foramen here is very circular in this vertebrae. And another important feature here is that the transverse process also has additional facets, which are the transverse costal facets. Again, the costal refers to the ribs. And guess what? This is a point of articulation with the rib, and we will see when we talk about ribs here at the end of today. Here, we're gonna see which portion of the rib articulates respectively with the transverse costal facet and demifacets here of the body that we just talked about. Of course, these that we talked about right now are additional facets, but of course, don't forget that there are the articular facets, okay, that typical of each vertebra there are the facets that we talked about at the very beginning, okay, and so those are always present, and they are fundamental for, of course, these are here, joining and articulating the superior and inferior vertebrae with one another. Okay, so don't forget about those ones; they're always present. And now we're going to talk about lumbar vertebrae. Okay, lumbar vertebrae is span from L1 to L5, these vertebrae have massive bodies, and you can understand why. These are the vertebrae that receive most of the pressure, most of the weight, and so of course the bodies here are really massive, really big, and they have a very short pedicles, as shown over here, and they have a flat, very pointy, let's say, spinous process that points posteriorly, of course, and the foramen has a triangular shape here, very, very, very definitive triangular shape. And as we talked before about it before, if you look at articular facets, they almost are 90 degree, they have a 90-degree angle, and so this 90-degree angle of orientation, it locks the lumbar vertebrae together and prevents rotation. Okay, we talked about this at the very beginning, so this is one of the features that I want you to remember. All right, so now we're going to talk about the last two portions, basically, which are represented by the sacrum and the coccyx. The sacrum is a triangular bone, okay, recognize the triangle for me here, and is actually made by 5 fused vertebrae from S1 to S5, they're fused, and the superior articular process articulates with L5, with the lumbar vertebra number 5, okay, and so you have this superior articular process, of course, on each side, okay, This is the process that will articulate with an inferior articular process of L5, okay, which is going to be located above it. This bone articulates inferiorly with the coccyx, okay, which is over here, and laterally with the hip bones, okay. And in fact, we have an articular surface on each side. This articular surface is for articulation with the hip bone, forming a so-called sacroiliac joint. Other features that we can recognize, the sacral promontory. Here, this is actually more visible than visible in some individuals than others, okay. Anterosuperior margin, and then we have ridges that we can recognize. These are actually the points of fusion, okay, and there are just lines that are indicate the fusion of the vertebrae. Then we have the anterior sacral foramina, which lie at lateral edges of the ridges, okay. These are here, and of course you know what these foramina are going to be for. They are going to be for the passage of nerve and blood vessels as well, okay. Then we can recognize another feature. These are wing-like projections that are called ala or ali. Ala is singular, ali is plural, okay, shown also here. Again, as we can recognize the anterior sacral, the anterior sacral foramina, if we were to look at the bone from a posterior point of view, which is going to be this one, posterior, then we would call them posterior, right? Posterior sacral foramina. It's the same thing, okay? We are just looking at them from a posterior view, okay? Again, the median sacral crest, which are bumps on the posterior midline over here, okay. This is another feature that we can appreciate from a posterior view, okay. So the median sacral crest, which you can feel them if you touch your area of your sacrum. And of course, the sacral canal, which is a canal that runs through the middle portion, the medial portion of the of this bone, and this is for the passage to continue for the passage again of the spinal cord, and then we have another opening here, which is the sacral hiatus. Here is a large opening at the end of the canal, okay, located over here. And coccyx is represented here, okay. These in this the coccyx length, let's say, varies between people, and it can be formed by a fusion between of 3 to 5 fused vertebrae. So normally we say 4, okay. So again, in these ridges over here are different in different individuals, meaning different numbers of vertebrae are fused. And of course, it articulates superiorly with the sacrum, and there is nothing inferiorly, okay. It doesn't have much of a function, okay. It's kind of, if you will, a residue of a tail that we used to have. All right, so we're done with the vertebral column. Now we're going to talk about the thoracic cage. Okay, we're going to keep this one short and sweet. Few things to remember. Thoracic cage is composed of thoracic vertebrae posteriorly, okay, as essential part of connection, the sternum and the costal cartilage anteriorly, okay. Basically, we're talking about this. All in blue is the cartilage, all right. And then, of course, the ribs laterally, all right. So posteriorly, a portion of the thoracic vertebrae, and laterally the ribs, and anteriorly the sternum, which is this bone over here we're going to talk about, and the cartilage which connect the ribs to the sternum. What's the function here? Protect vital organs inside this cage. Supports the shoulder girdles, as we will see, and the upper limbs, and also provide attachment sites for muscles of neck, back, chest, and shoulders. Okay, these are the functions. Let's take a look at the sternum first. This is also called the breastbone. Okay, it's this kind of massive bone over here. Okay, and we can recognize several regions here. There is the manubrium, which is the superior portion, okay, superior, going towards the head, that articulates with the clavicular notches over here. Okay, this is the clavicle. We haven't talked about it. We will. Okay, there is an articulation point here, and also with the ribs number 1 and number 2. We're talking about the manubrium. Then we have a body, okay, which is basically this area here. And so it's the mid portion, which articulates with the costal cartilage, okay, over here, of the ribs from 2 to 7, okay. There you go. And then we have a process, remember this is just a projection, is the xiphoid process. And this is the site of muscle attachment, and it does not ossify until later in life, until the age of about 40. That's kind of interesting. Now we're going to take a look at the ribs. And so what to know about the ribs? There are 12 pairs that form the sides of the thoracic cage. Okay, you can count them. And all attach posteriorly to the bodies and transverse processes of the thoracic vertebrae. I have it in the next slide. Remember when we have spent a few minutes on the thoracic vertebrae to understand all these facets that we find, additional facets that we find in the bodies. Remember the demifacets, and on the transverse processes of these vertebrae, which are dedicated to articulation with the ribs specifically. Okay. We can distinguish two sets of ribs here, the true versus the false ribs. Why do we distinguish that? The true ribs are from 1 to 7 here, and the false ribs are from 8 to 12. The reason why we call them true or false, it's in reference to if they have their own, let's say their own dedicated cartilage that connects to the sternum. So the true ribs attach directly to the sternum by individual costal cartilage, whereas from 8 to 12, you see how they all merge, okay, into one point of attachment, And so they attach indirectly to the sternum by joining the costal cartilage um, of the above, of the rib above, or two of them are totally floating. Okay, 11 and 12 are floating because they're not even attached. Okay, to the sternum whatsoever. So these are known as false ribs. Okay, and the true are also known as vertebrosternal, and the false are known as vertebrochondral. Okay, but I'm going to ask you to remember true and false. All right, so let's explore the main parts of the rib, okay, and how a rib connects to the vertebrae, thoracic vertebrae, okay, that's important. So first of all, regarding the various parts of a rib, the main part of a rib is known as shaft, is this area over here. Then we have the junction with the costal cartilage, which is represented over here, over here. Again, try to orient yourself. These two are oriented in different ways, okay? So you have to be able to kind of recognize that on your own. And definitely helps when you have the vertebrae there, so you know that, of course, ribs will articulate posteriorly with the vertebrae, so you know that this is the anterior part, and this is the posterior part in this diagram here, okay? And so when we look here, we can recognize a head, which is the posterior end of a rib that articulates with the bodies of the vertebrae at very specific facets, which are the demifacets that we talked about earlier, remember? Then we can recognize the neck. Neck is just a constricted region, okay? Nothing over here, nothing too important. And then the one important region to know about is this bump over here, which is the nobilite structure is known as tubercle. And this is the point of articulation of the rib with the articular facet on the articular facet that is present, dedicated on the transverse process here, the transverse costal facet of tubercle, the transverse costal facet of the vertebral process, which is for the tubercle of the rib, okay? It's represented here. Here you can see, sorry about the word confusion, okay? I'm gonna repeat it. So the tubercle of the rib over here, okay, articulates with the transverse costal facet here on the transverse process of a thoracic vertebra, okay? And so these are the important points here, okay? How the ribs articulate respectively with posteriorly with the vertebrae, and at which points, okay? And anteriorly, of course, through the costal cartilage, okay, as we have seen in the previous slide with the sternum. So that's pretty much it. Ribs are pretty easy. I guess the trickier part is remembering about all these facets, these additional facets. But if you understand them when you study the thoracic vertebrae, then this should be really easy for you to understand. Okay, so I'm done with this one, and Next, we're going to explore together in a synchronous class the appendicular skeleton.